So Senate Bill 320 is something I've been working on for quite some time. I'm really proud of this bill. It establishes guidelines and criteria for individuals who are incarcerated to apply for medical parole. The reason that this is a really good bill is because right now we don't have any clear guidelines as to who is applicable to be released due to medical reasons. And we have tons of data that show how much incarcerated individuals cost when they have near-death diagnoses. And so this bill is really targeted at people who are basically appropriate for hospice, which would be a 6-month diagnosis or less with the inability to perform activities of daily living or ADLs. So this could potentially save the state a lot of money for individuals who need a higher level of care than what a prison system is really set up to care for our inmates, and I think it'll be a really big fiscal impact that it saves our Department of Corrections.
And a lot of people may not realize that when an individual is incarcerated, regardless of how old they are, while they are in state custody in a state facility, the state does not get the benefit of any Medicaid coverage for that person.
Exactly, yes. And so that is basically a private pay expense for the state of Oklahoma. Whereas if an individual who qualified for like a long-term care setting could potentially exit the system if they're a non-violent criminal or someone who does not pose a risk to society any longer, they would be able to be excused from prison on a medical parole and be able to do inpatient long-term care services or have family members care for them potentially that wouldn't cost the state really anything if they were under the care of family or another care type of provider in a home setting. And then the state Medicaid system would potentially pick them up in a long-term care setting. And again, the costs in a long-term care setting in the state of Oklahoma are going to be drastically less than what we're paying per day in the prison system for an individual who can't care for themselves.